Hello, and welcome to this Knowledge Exchange webinar. The subject of this webinar is the SCIROCCO Exchange project. My name is Lisa Barry. I work as a Knowledge Exchange Manager for the International Engagement Team, Technology Enabled Care and Digital Healthcare Innovation at Scottish Government. Today's webinar is being delivered by Dr. Andrea Pavlickova. Andrea is International Engagement Manager, Technology Enabled Care and Digital Healthcare Innovation at Scottish Government. Andrea will explain the background to SCIROCCO Exchange, what it's all about, and how potentially you could become involved if you find this topic of interest. The webinar is being recorded today and will be accessible after a very short gap on the SCIROCCO Exchange website. So if you have questions after listening to the webinar, there are ways that you can contact us and the information will be shared at the end of Andrea's presentation. Please do get in touch if you want to find out more. In addition to the background, Andrea will explain a little bit more about how SCIROCCO Exchange is really working with the partners who are involved to support all of the participating regions to deliver integrated healthcare solutions. And if that's a topic that's of interest to you, please do get involved and help us to move this agenda forward. I'm going to hand over now to Andrea, who will start the presentation.
Thank you very much, Nessa. So as it was introduced, the main focus of this presentation is to give you some background information on project's activity and also what we have done so far and how you can get involved. So the main focus of the project is the capacity building for integrated care. And I will just start with some general information. The project started this year in January, and we are the consortium of 9 national and regional healthcare authorities in Europe. And as you can see from the list, we have really nice diversity of regions across Europe, coming from different healthcare systems, from the countries with a different organization of integrated care, which really brings a special value when it comes to the knowledge exchange and mutual learning about how to implement successfully integrated care. Our consortium is also supported by a number of research organizations and competence centers, which are responsible primarily for the evaluation and validation of our project activities. And we are also glad to have as partners the membership organization, which also help us with the spread of dissemination of project findings. So in terms of the overall objectives of the project, as I mentioned, the main focus is on integrated care and how we can support the capacity of regions to implement integrated care. And the main rationale is that we are using the knowledge transfer and improvement planning as a vehicle to support the capacity of regions to implement integrated care. What is important to highlight is that despite the fact that the project has started just this year, actually the journey of SCIROCCO Exchange started back in 2012 with the initiative called European Innovation Partnership on Active and Healthy Aging. And this is the initiative which was launched by the European Commission as a vehicle to address the challenges of aging population in Europe and its consequences. And what is interesting about this initiative is that it was always driven as the voluntary collaborations of a number of stakeholders across Europe. So it involves national, regional healthcare authorities, academia, industry, civil organizations. So really emphasizing that cross sector collaboration in the area of active and healthy aging. And as part of this initiative, there were 6 groups which were established, and one which I would like to highlight is the Action Group on Integrated Care. And the main remit of this action group was really to see how we can basically help each other to implement and scale up successful chronic conditions management programs and integrated care programs in Europe to avoid unnecessary hospitalization and improve the active and healthy aging of European citizens. As part of the group, we've conducted a number of activities such as like mapping of existing good practices, existing integrated care solutions, to really enable mutual learning and avoid any possible duplications when it comes to the implementation of integrated care solutions. So we've created a number of repositories of good practices. We have also encouraged learning between the learning about the outcomes of a number of national or European projects. We have also tried to basically use different expertise and skills available in the group to really help each other to learn about how to implement integrated care. However, what we've learned very quickly in this group is that despite the fact that we have a number of evidence, number of good practices illustrating successful implementation, it has still remained very challenging to actually understand how we can use this evidence. So simply saying, if we like particular good practice, let's say in the Basque Country, what does it actually mean to implement this good practice in my own local environment? What elements of this good practice are actually transferable? Is my environment ready to adopt such a good practice? Do I have local conditions created for the adoption of integrated care? And if not, where can I go for help, or what information I need to improve my local situations? So we have very quickly learned that actually implementation and scaling up of integrated care is a matter of local conditions and local context that enables the adoption of these successful integrated care solutions, and that we really need to understand these local conditions in order to really speed up the adoption of integrated care in Europe. So through the mutual learning and through the desktop search, we've actually realized that we are missing the tools and frameworks or methodologies in general that can help us to understand these local conditions that enables the adoption of integrated care. And that's where we started to think about what we call at that time maturity model for integrated care. As I mentioned earlier in my presentation, the initiative was really driven by voluntary collaboration, and the same implied for this piece of work on the maturity model. So we have engaged with 12 regions in Europe, which were part of the European Innovation Partnership at that point. And we have scheduled qualitative interviews with these regions to really understand how they implemented integrated care. So it was very much bottom-up driven approach. We haven't done any literature review. We have really tried to speak with the authorities themselves in order to understand how they've done it. So we've asked them what was their situation before the successful implementation of integrated care. What is the situation looking like now? So what were the main success stories, but also what are their ambitions moving forward? And when we analyzed those 12 interviews, we have actually realized that there were some common themes or common factors that influenced the implementation of integrated care. And we have grouped them in 12 dimensions. So the model consisted of the dimensions such as capacity building, structure and governance, e-health, population approach, citizen empowerment, and others. And what we've done in the next step, we were actually looking across each of these dimensions and try to understand what are actually the objectives along each of these dimensions, but more importantly, what will be also the indicators that allow us to measure maturity along each of these dimensions. So we have come up with this rating from 0 to 5 in order to basically try to distinguish the different possible level of maturity. And what it meant in practice was that if you actually implement this maturity model, actually if you assess yourself across all these 12 dimensions using the maturity model, you can come up with this very easy spider diagram, which provides you a very quick detection of where you actually stand in terms of integration agenda. So for instance, looking at this spider diagram, we see that dimensions such as capacity to change or governance are scoring relatively low compared to areas such as capacity building or finance and funding. So it was really a very quick way of analyzing the gaps and strengths in your systems. However, what we realize is that if we actually want to really develop a much more robust model and actually think about some more user-friendly version of this model, that we need further validation and testing. So we have moved from this voluntary collaboration to the first application for funding, and we secured this project called SCIROCCO, Scaling Integrated Care in Context, back in 2016. And really the main remit of this project was to do the proper validation and test the model in real life settings. As a result of various iterations, various testing, we have moved from this conceptual model to online self-assessment tool. What is important to highlight is that as I mentioned, it is a self-assessment tool, so it's not the objective evaluation tool which tries to measure what is good or not good in the place, but it's really the tool which is trying to capture the perceptions of stakeholders on how the integrated care has been implemented. Everyone who is interested to use the tool can just use the provided link, register, and use the tool for free. The tool has also been translated now in a number of languages, such as Spanish, Italian, Czech, and Hebrew. And as you can see also on the slide, we've been able to test this tool with more than 65 organizations and regions in Europe and beyond. Which actually really for us demonstrated the fact that there is a real need for these tools, but also through this project we're able to build a very strong SCIROCCO community that help us to shape the tool, refine the tool as needed, really based on the user's experience. So the whole development of the tool was very much users driven and bottom up driven. We have kept the same principles for the tool as for the conceptual model. So each dimension has its objectives and assessment scale. And as I mentioned, the main objective of the SCIROCCO project was the validation. So we have conducted a Delphi panel to help us with the better definitions of the assessment scale. So most of the modifications throughout the project was around the assessment scale, but the principle and the structure of the tool remain the same. So what has changed is that once you register and use the provided link, you are asked to fill this 12 questions questionnaire, which reflects 12 dimensions of the SCIROCCO model. And once you assess your maturity along each of these 12 dimensions, you come up with this spider diagram, which basically has now much more improved visualization. And I think what is also interesting about the tool is not only that quantitative measurement, so the allocation of numbers from 0 to 5, but it's the box on the justifications where the stakeholders are actually asked to provide the evidence or justifications behind the quantitative scoring. And this has helped us to actually collect a number of really very successful number of really strong qualitative evidence on how to implement integrated care. So just looking at the functionalities of the tool, or how you can actually use this online version of the tool, there are two main functionalities on how to apply the tool. The first one is around the assessment. So you can apply the tool on two different levels. The first one can be at the level of particular good practice or particular intervention. And as I was saying, the objective of the tool is not to evaluate if the good practice is good or not, but the objective is to identify which elements of the good practice are actually key for its transferability or for its adoption to other settings. So it helps you to identify which of those 12 domains are critical for the adoption of the good practice, and which are actually maybe not that much relevant for its transferability. The second level, how we can apply the SCIROCCO tool, is at the level of the healthcare system. And it doesn't matter if the healthcare system is organized at the national level or regional level. The tool is very flexible when it comes to the level of implementation. But if you implement it if you use the tool at the level of the healthcare system, it basically helps you to detect what are your strengths, what are your weaknesses. So again, it shows you which of the dimensions are actually supporting the implementation of integrated care, or which dimensions are actually still needed a bit of work to improve the implementation. So as it is illustrated in this example, for instance, we have the three dimensions in green, which, where the regions are very strong, mature in integrated care, but then you can also see the ones where, as I said, the further improvement and the further work is needed. The second functionality of the tool is then the facilitation. As many of you realize, the implementation of integrated care really involves working in multidisciplinary teams. You have wide range of stakeholders coming from a different background, different environment, disciplines that are required to work together. So the tool also basically supports these multi-stakeholder discussions in the way that the assessment can be done at the individual level. So you can ask, let's say, a particular manager, doctor, providers to do the assessment. But what is interesting is that when you actually bring all these assessments together, and when you bring this team together to discuss the outcomes of the assessment, to have a discussion why particular group of stakeholders is scoring, let's say, 2 across particular dimension, but the other are thinking, much higher. And the idea is that all these stakeholders need to actually, at the end, come to a particular consensus. So it's the tool drives the discussion, because it's obviously discussion is done around those 12 dimensions, but it also makes stakeholders to basically agree on the priorities moving forward, on the domains that need to be addressed moving forward. And the other way of facilitation is also in terms of supporting much more effective knowledge transfer between the regions. So if I know my gaps in the system and I want to improve the particular domains, the tool help us to basically navigate where to go for help. So if 2 regions do their self-assessment on the maturity either of the healthcare system or the requirements of good practices, then we can compare the local context and we can see where there is actually the fit between the 2 regions to progress for the knowledge transfer, or where actually the local conditions wouldn't support the successful adoption or improvement of integrated care. And this is where actually the previous project stopped for us. We have done the assessment, we have tried to identify which regions are compatible to work with each other based on their weaknesses and strengths, but there was always this question, so what is next? If I understand my gaps and I know where to go for support, what do I do next? And that's basically where we have secured this follow-up project, SCIROCCO Exchange, and as I was saying, the main focus is on the capacity building support, but through the knowledge transfer and improvement planning in particular. And what we have learned through SCIROCCO projects and also the European Innovation Partnership is that knowledge transfer is indeed effective enabler of capacity building support, but it needs to be managed effectively. So there needs to be a support and there needs to be the infrastructure for this knowledge transfer. And the main objective of this SCIROCCO Exchange project is to actually provide this infrastructure, to test this infrastructure again with the users, with the real, in the real settings, to shape this infrastructure in the way that it would actually work for the authorities at the end. So as part of this project, we are trying to develop this, what we call knowledge management hub, which would actually function as an integrator and also facilitator of this capacity building support. And I'll just very briefly outline how it should work. So the hub will have 4 main functionalities. So, and as you can see, the integral part of this hub is this SCIROCCO tool, which I explained briefly earlier. So regardless of which functionalities of the hub you want to use, really the first key priority is to do the maturity assessment. So we really need to understand the local conditions in a particular region or particular organizations that enable the adoption of integrated care. We need to understand the priorities of the organizations that that they want to take forward for the future improvement and the future learning. So after the identification of these priorities, the SCIROCCO Exchange Knowledge Management Hub should then be able to look for what is available on the market as some sort of like help to address those priorities. So we will be looking at what we call assets in this project. So it's basically simply saying the existing evidence on integrated care. So it can have the form of the good practice, it can be a particular expertise of particular professionals, it can be some guidelines, tools, and any other types of the evidence. So the hub will generate those assets, but also try to personalize those assets based on the needs identified in this step 1. So once we know what we are going to improve, what is on the market. We will then, through the knowledge transfer, try to actually implement that change. So in the third step, we will provide a dedicated capacity building support, which can have a form either of the study visits or exchange of the professionals, exchange of the knowledge in terms of various webinars or learning, exchange of staff, as I mentioned earlier. And then the final step would be to do a proper improvement plan. So there will be a technical assistance on how to implement that change. And I'll just briefly illustrate how each of these steps will work in a practice. So as I said, we are starting with the maturity assessment. So it's this simple question: is my local environment actually ready to implement or adopt integrated care? So we will be applying the SCIROCCO tool at the level of the healthcare system to understand what are the strengths and what are the weaknesses. So at this stage, we will be asking the authorities to identify what are the areas for the improvement. And as you can see, this spider diagram includes number of spider diagrams, which basically each of them illustrating a perspective of a different stakeholders. Because what is really key and what we are trying to emphasize throughout the project is that we really need to make sure that in this process we have all stakeholders involved. So we need to really listen to every group in the system in order to actually be successful in terms of implementing the change. So we will be using the tool to mobilize basically all stakeholders involved. And as I mentioned earlier, really, as the main rationale of this first step is to make these multidisciplinary teams to agree on the priorities moving forward. So they really need to work in this consensus building spirit. They need to come with a clear set of the priorities that they want to take forward as part of the project. So for instance, on this slide, we were illustrating discussions about the use of the e-health services. So you see a different perspective of different stakeholders. You have their clinicians, administrator, IT specialists, each of them having a different view, but at the end they have to come to a decision. So it's really, the tool is helping to implement this very collaborative way of thinking. In the next stage, once we understand those priorities, as I was saying, the hub is going to look what is available on the markets to help your situation. So, for instance, on this slide, we have illustrated the situation along the dimension of the population approach or risk stratification. So in principle, the idea of SCIROCCO Exchange is like how you can actually improve your maturity. So how you move, let's say, from the scale of 0 to 2. And we know that there is a number of assets on the market. We have, as I was saying, we have various outcomes of the projects, we have good practices, we have some expertise, and you can actually structure that assets based on their maturity as well. So the idea is that through the knowledge management hub, we should be able to identify which assets a particular authority needs to take into consideration to move along this dimension, but also what is important in the next stage is how well this asset fits to the local environment. So as I was saying earlier, it's not only the identification of the assets or the evidence that is on the market, but how well that evidence is actually reflecting my own environment. So again, through the hub, we will be able to compare and contrast the maturity of the local environment, how the environment is ready to implement a particular identified evidence. And as you can see, for instance, on this slide, we have used the assessment of 2 healthcare systems. So we envisage the situation that the capacity building support will be done through the study visit. So we have used 2 different assessments of 2 healthcare systems. One healthcare system is in yellow, the other one in blue, and the areas where you actually see the commonalities are overlaid in that green color. So through the hub, you are able to identify which dimensions you are actually both doing quite well. So you actually have some common elements and you can progress some further learning. So for instance, in this case, there was very strong commonalities around the governance, capacity building, innovation management, but in contrast, there were very strong differences in the areas such as population approach, citizen empowerment, and the hub will help you to dig out the details why there are so differences. So you are basically doing almost like a feasibility study, trying to figure out if the transfer of a particular evidence or implementation of a particular evidence is feasible in your system or not. So this is really a very important element when it comes to the scaling up of particular solutions. As you know, we all know that it's not about copy pasting of particular solution, but it's more about the adaptation. And actually, a lot of the knowledge transfer may stop at the level where we conclude that actually the transferability is not feasible because of particular conditions in the healthcare system. And after we know these conditions for the transferability, after we understand to what extent it is feasible or not, we can then work on a particular improvement planning. So, for instance, here is the brief example of the action plan of Puglia, based on the outcomes of, as I was saying, example of study visits. So this is really just at the early stage, but the idea is that through the knowledge management hub, we will be able to identify not only the areas of improvement, but also the concrete steps on how to implement a particular change and provide the assistance of how to do it. So each of the regional and healthcare authorities will be able to identify what actions they need to take, what would be the anticipated outcomes, who needs to be involved, and what is the particular timeline for the adoption of change. And what we hope to achieve at the end as a result of this project and as a result of these 4 steps is that the local, regional and national healthcare authorities will actually have much more improved knowledge and understanding of their local priorities, and more important, they will be all aligned towards those common priorities. And hopefully this will in turn improve their capacity to implement integrated care. We are also hoping that through the Knowledge Management Hub, we will be able to better inform decision making, and not only at a local level, but also at the European level, but through much more effective mutual learning and knowledge transfer. And obviously, our ultimate objective is increased use of Knowledge Management Hub. As I was saying in my earlier slides, SCIROCCO tool was really developed and tested by a number of partners who were not necessarily member of the consortium, but they were really keen and influential to help us with the design of the tool. And it's the same what we're hoping to achieve through the knowledge through SCIROCCO Exchange, to really test the tool, test the hub with as many authorities as possible. So anyone who is interested to join us and to test any of the functionalities which were outlined, they are more than welcome. They can simply contact us through the details provided on this slide, or directly through our website or our Twitter account. I have provided the reference to both of these projects, as they are very closely interlinked, and both websites are populated with a different level of information and support currently available in the area of integrated care. So thank you very much for your attention, and I hope that you find this webinar useful.
Thank you, Andrea. That's fantastic. So much information packed into a relatively short webinar, and I can say with certainty there will be more to come for sure. But thank you, and a great invitation there from Andrea at the end to get involved, to test the functions, and to find out more. So we hope you will do that. Thanks again for your time, Andrea. That's us for now. Bye.